I don't know. I lost my actual mask, but this is before I start taking. Yes. I actually think it smells. Yeah. I can just think
Okay, I think it's 10:30 and we'll get started here. Appreciate everybody joining us on our weekly press briefing. Just only have a couple things from me today. The first thing I do want to continue to talk about is as we're phasing into this recovery, if you will, I want to kind of stress something that I talked about last week, and that was we're very focused on phase 2 and phase 3, and the further we get out in phase 4 and 5, you know, the less, the more tentative those plans are. As we can see, national, state, and local events and reactions changing and evolving. This whole pandemic has been one of just continual change and sometimes rapid change. Just want everybody to be assured that right now we're totally involved in phase 2 and kind of looking towards the advance of phase 3. And while we do have a plan all the way through the governor's 5-step recovery process, 5-phase recovery process, you know, again, a lot of those plans, even locally, are still remain tentative. So the one thing I do want to talk about, and again, kind of to reiterate from last week, is the wearing of masks in public places. You know, the governor in his phase 2 and 3 suggests it is highly recommended for both customers and employees to wear face coverings. And it's highly recommended for phase 2 and 3, and it's recommended through phase 4, which takes us, you know, into July. So with that being said, the city is continuing to provide in a somewhat limited supply of cloth masks from the Center Street Fire Station. I've got some groups I want to thank here in just a second, but again, these are cloth masks. They can be washed. We ask that those masks be worn in retail and public areas where public gatherings are occurring, public buildings, that type of thing, when the public is involved. So again, those masks continue to be available. I think I did a survey last week of our large stores, and there's at least one large box store that's requiring masks upon entering, and I'm very appreciative of that. Would like to see, at least by example, the rest of the stores maybe enact that policy, or again, I think it's more important that the public understand how important it is for their health to wear a mask when they go out and shop. And you know, I said last week, there's no mask police. We're not out enforcing that. The stores have taken it upon themselves. I think the stores have all done a great job setting up their capacities and their hand washing stations and the lines on the floor marking social distancing. I have talked to a few stores, and I'm somewhat disappointed in the lack of mask wearing within the stores by the general public. So I just ask, again, highly recommend, as the governor says in his recovery plan, that highly recommend those masks be worn in phase 2 and 3, and recommend that they be worn all the way through July 4th. So I did want to thank several groups that have been sewing tirelessly, providing masks to the public through our fire station distribution. Ann Sweet has got a group, and again, this list is probably by no means full and complete, but I will mention those that have been brought to my attention. The Liberty Sewing Circle is making cloth masks. The North Central Indiana American Sewing Guild is making cloth masks. There's a group, Edna Thomas, Susan Hayden, Joe and Darlene Shepard are making masks. And I'm sure there are more, and I'll try and keep up with those kudos as they become available. But that is providing at least a central source of masks, which again, I feel is a very big part of the governor's recovery plan as we move forward. As we'll talk here in a moment with Dr. Remington, again, we are locally going to keep our eye on cases and the contact tracing as the state, as that evolves centralized at the state to help us as we make our decisions. We'll be watching local numbers, both in our county and kind of keep an eye on the surrounding counties. And again, we'll, I'm sure, get into that discussion here in just a minute with Dr. Remington. City offices are tentatively scheduled to open to the public with restrictions and precautions on June 1st. And as we've all through the pandemic, our city functions continue to be supported by our personnel, both here in the city buildings and at home as they log in and work from home. I think Alan Teo is here from KEDCO, and we'll talk in a minute about some of the recovery funding that has been made available federally by the state and even locally, how that impacts our businesses, our communities, the individuals, our non-for-profits, and we'll let Alan talk a bit about that here in just a second. We are awaiting details of some state funds that were announced last week that will help the city reimburse for direct reimbursement for COVID-related expenses. That has been from the governor's office, should come out later this week, early next week. So we'll still kind of waiting for the explanation and the details on that. So with that, I will turn it over now to Dr. Bill Remington, the Kosciuszko County Health Department officer, to talk about our caseloads and the contact tracing and local decision making on the recovery process. Should have a good discussion, and then obviously we'll switch back over to Alan to talk to, have him have a discussion about KEDCO's role in our recovery, and then we'll take our questions. So, Dr. Remington.
Great, thank you, Mayor. Our cases of COVID-19 in Kosciuszko County residents is increasing as we anticipated it would with increased testing availability. In perspective, our testing to date, cumulative testing since the beginning of this pandemic, doubled in the last 2 weeks. So many more people are coming to a test, and as we hear the individual stories at the health department, the overall sense is that most of these are relatively minor cases and a growing number of cases that have no symptoms at all. People were tested as part of a contact approach, case contact approach, or an employer-driven mandate. So that puts a different set of lenses on our growing case count. I did some simple math, and even though we don't perfectly know the total number of tests done week by week, our cumulative percent of tests positive as of Monday was 4.5%. If you go back a month, it was 5.5%. If you look at the new tests, new positives in the last 2 weeks, again, I just did simple math, we had 17 new positives in those 2 weeks, 400 out of 470 tests, to give you a 3.6% positive rate out of those tests. So I want to provide some reassurance that yes, our case count is going up, but I don't sense we have a disaster at the door. It's reflecting a different motif to testing and a different availability of testing. I went and looked at some national data earlier this morning. And again, just to give you a reassuring perspective, and all of this is from the COVID website with the CDC, and looked at their weekly update. And some key metrics are improving across the country, if you want to take a 10,000-foot view. So number one, regarding the virus, there's a decreased percentage of tests positive nationwide. If you look at a syndromic surveillance perspective, outpatient emergency room visits attributable to COVID-19-like symptomatology. Again, these are not confirmed cases, just people presenting to an outpatient or emergency room setting with fever, cough, chills, aches. That percentage has decreased again when compared to the week previous. If you look at severe disease, there are two metrics, hospitalizations. The hospitalization graphic on this website's a little challenging. It's a cumulative graphic, so it will only get bigger, and as you would expect, it is creeping up. I wish we could look at an interval hospitalization rate, and I'm sorry I don't have that. But if you look at the deaths attributable to COVID-like pneumonias or influenza-like pneumonias, if you look at the percentage of deaths across the country attributed to that broad syndromic class, not even necessarily depending on a confirmed test positive, that percentage has decreased again. So on three broad parameters, the virus and virology case count, the outpatient emergency room visits, and then severe disease, if you look broadly at the 10,000-foot view, if you will, on those three fronts, it's improving in the aggregate. Now, that's not to diminish the feel of the occasional bad outcroppings, and there are those. We hear those in the news. We do not have a bad outcropping cluster of cases in this county. I'm thankful to hear that from my communicable disease staff. I'm happy to report that to you. As the case counts go up, it makes it a little more challenging for small local health departments to do very quick and nimble case investigation and contact review. That will be turned over as per a state contract within a week for this county. We will still be involved as a health department. We expect lots of questions still coming to us. This organization that received the state grant is hiring on hundreds of workers to do this case contact work. So the case contact work remains important. So if you have a positive test, whether you have symptoms or not, the traditional playbook is you manage that as a true positive, you isolate that patient, and you quarantine, perhaps modifying that quarantine directive to close contacts, and we think primarily of household contacts in that context. And that will continue to be the playbook. And I imagine that will change as time goes on, as the severity of these disease clusters perhaps changes. Some of that may change too. So we are providing that still very efficiently at the local level with our county health department staff. They're working harder in the last few days, for sure. We are still receiving many phone calls at the central office in the courthouse, and I understand this morning there'll be yet another shipment of personal protective equipment coming our way from the state, and we'll be distributing that in the near future. So I say all that to say that look beyond the growing case numbers for our county. That doesn't do the topic justice. Look at the aggregate, look at the percent positives if we can get to that, look at hospitalizations and deaths, look at the feel in our frontline venues, offices, emergency rooms, urgent care clinics. And the overall feel is it's better. We have avoided thus far in this county a disaster. I'm very thankful for that. So good news, I think, despite a number that may be a little frightening to look at first blush.
So part of the governor's requirement as we continue with recovery is the institution of this centralized or state central system of contact tracing. Mm-hmm. So contact tracing, as you describe, is an investigation of what an infected, positively COVID individual has come into contact with to try and manage the spread. Are there statistics with contact tracing that will show changes or progress, or is contact tracing just an investigational technique that will try and keep everything down? It's a tool that we have, but will there be statistics that are available from a centralized contact tracing effort that will show progress or the other way?
Yeah, that's a great question. I'm sure there will be. If nothing else, the growth of percent positive cases, the growth or decline of hospitalizations. So you have to step back and look at some end results of all that groundwork, if you will, the case investigation, the contact work, all of that, if done correctly, we hope will mitigate hospitalizations, deaths, and percent of tests positive. So you'll look at those endpoints. It will generate data of their own. Certainly you'll get to know more about each case, the amount of contacts that may be found to be positive in the world of that individual case, so the efficiency of the spread of the virus within those homes or businesses that the case contact work is proceeding in. That will definitely generate some data. Whether that will flow back to us quickly is yet to be seen.
And I know I've had some discussions with Bob about the contact tracing, Bob Weaver at the Health Department, how the state contract will be applied, if you will, locally. Will we have involvement, or will we be just giving results? I assume the data will be exchanged or accessible by our county health department. Mm-hmm. Are you familiar with how that's going to work?
Not perfectly.
Okay.
I think it will play out and we'll learn. We anticipate to be able to have our finger on the pulse of the metrics, the case count, for instance, and percent of test positive, and the new cases that they're identifying. We anticipate that we will still have many questions coming to us at the local level with each of these case contact investigations, whether it be a cluster of cases in a particular congregate setting of some sort. I'm sure that'll come back to play pretty heavily with us as a local health department. There will be a script that these newly hired case contact investigators will be working with, so it'll be pretty rote. And as we have felt with this over the last two months, there's a lot of nimbleness you need to have to give best answers, I think, to people. So we'll still have phone calls and still have quite a bit of involvement.
Right, okay. Well, thanks, and I'm sure there'll be some more questions here, but I appreciate that update. And again, as always, I know we've been very reliant on the public health information and that approach to this whole thing. I know it's becoming more complex as the economy is involved in trying to mitigate the negative impacts there. It's becoming more of a juggling act, but I still think it's critical to know how important the public health data and the approach from a public health standpoint is to working our way through this and leading as we make decisions. So again, I certainly value Kosciuszko County Health Department, yourself, and what we're doing in that realm here locally. So I know Alan has been very involved. Alan works a lot behind the scenes to try and make things happen, and does a very good job of it. he was instrumental in getting the Okra grant to assist with recovery for small businesses. LMI specifically set up the SBA fund locally as well. So, Alan, I know there's probably a lot of things to talk about, again, kind of on that more economy side and local impacts on our local businesses and industry. If you share your thoughts this morning.
Of course. Well, Mayor, thank you for the invitation here this morning, and Mayor Tollimer, Dr. Remington, thank you both for your leadership through this these unprecedented times, right? And so for us at the KEDCO, at the countywide economic development organization, certainly these are unprecedented times for us. We're well set up to be able to work remotely. We did transition to remote work early. We'll reevaluate that, I think, about Memorial Day, whether or not to reopen the office, but I think we've adjusted well. We're set up again with our 8-member team and a couple interns to be able to work remotely and continue working with companies, working with our community partners. And so our business plan, our mission, of course, is to convene, build, and show the community's economic growth resources. And we're not looking backwards. We're not looking to go back to the way things were. We're looking to go forward. And so a couple examples of how we're doing that. With the convene, we look to bring people together. We look to connect with business and community leaders. So we've transitioned to virtual meetings, even with our monthly entrepreneur meetup, even with our quarterly agribusiness and medical device roundtables. We're still able to connect with people and connect to resources. Other ways we're connecting, of course, with banks and groups that are able to access some of the programs like the Paycheck Protection Program, the SBA loan programs. Hearing positive news, so many companies have been able to access the Paycheck Protection Program, for example. The banks have caught up. I know we have a number of banks in the area that have done just fabulous work, working over hours or overtime, so to speak, to help process these applications. And banks that have worked through their backlogs and now are caught up. We're also, of course, then looking for how we can build solutions, help companies build solutions, help build solutions to problems. So examples, is that me?
Oh, I keep turning.
That one won't turn. Maybe just push it down away from.
There we go.
There you go.
It wasn't me. So helping companies through this, we have put together the Small Business Relief Fund, so appreciate the partnership with the City of Warsaw to invest in the Small Business Relief Fund. We have right now 4 applications for small business relief to be approved today. We have 3 more completed applications and another 15 to 20 in the hopper, so to speak. And we're also building that fund. We have dollars coming in from Okra. We have a request pending to Kosciuszko County Council. So before long, we may see we will have somewhere between $400,000 to $500,000 available to help small businesses. And really, we're looking to help with job retention and business recovery. So loans, zero interest loans up to $10,000 each. Again, to help with, let's keep people on payroll. Let's help businesses recover and maybe evolve their business plans or business models. And so again, we have about somewhere between 20 to 30 applications right now pending, with more dollars available in the very near term. So that's one example of how we're adjusting and accessing or providing tools to help business. But certainly working with communities as well and looking for ways that we can help out. Even things as simple as connecting to some of the various playbooks that are available to help companies adjust how they're set up. Some of the webinars that are put together to do the same. This is a longer term investment undertaking, so we're looking to help people evolve. And then really, there are just such great stories in the community about companies that are contributing, either individuals, organizations, companies. A couple examples come to mind, of course. The team at Strevin up the street on Detroit Street now producing hand sanitizer. The team at Paragon Medical with their facility here in Warsaw producing a proprietary face shield product. So again, just a few examples, but we're seeing so many just great stories of how this community, individuals, organizations do contribute and are committed to helping sustain and grow our community. And so for us, we think about just if we look backwards at some of the businesses that were born during crisis or the innovations that emerged during conflict, we're just very positive about as we move forward, as we go forward, working with companies, helping them adjust their business models, reforecast how they're doing business, make sure we're even connecting with our customers as the businesses in the area to do the same, but that we're going to come out of this with communities that are stronger, companies that are can help us grow going forward. So plenty of things still happening at KEDCO, and appreciate again our team, our board of directors supporting us going as we work through this, and we'll have more to come.
So, you mentioned locally some small business relief funds that are available through KEDCO. What's the quickest and easiest way for small businesses to plug into that? Right,
so Rhonda Laddig is our entrepreneur navigator, our business navigator, and so she's taking care of all the application processes. Either Rhonda's at R Laddig, it's RLADIG, at kosciuskoedc.com, or we have a simple online application on our website. It's all online to submit the application. We try to make it as just simple as possible, but just looking to understand what other resources companies have been able to access, if any, what their needs are, how they can utilize these dollars, and really, again, how do we help companies maintain payroll and help to recover and revolve their business models.
Had a discussion with the banker the other day, and it's my understanding, and I'll ask how you feel about this. I understand there's still PPP available from the second wave, so that I know I've had some folks that have been either uncertain or not understanding how to go about it, thinking the process is difficult. What are your recommendations on the PPP that, again, appears to be still available?
My understanding is the same. There's still money available in the Paycheck Protection Program. Banks, again, have worked through their backlogs, so are able to process applications more quickly. So I recommend anyone to contact their banker or any of the banks that's utilizing the program. Again, Rhonda and I are willing to help as well if it's us connecting with the banking partners, helping to think through some of the different programs that are available, or even looking at other partners in our network of economic development resources, like the folks at the SCORE network or SBDC. Again, can help businesses really determine which are the right resources to meet their needs.
Sure. Okay. I know one thing that has really shined, if you will, as a real issue has been the broadband issue through this whole thing. Schools having difficulty in pockets around the county with e-learning. I know telemedicine now getting stressed, and again, broadband seems to be an issue that we, well before this epidemic or pandemic, we knew it was a concern. How do you see this latest very apparent example of our lack of infrastructure? Do you think that's one of those things you see as kind of reinventing our priorities as we move forward from this?
Sure. I mean, I think this crisis has helped to underlie that broadband isn't a nice to have, it's a must have, right? For school, for business, for anything. I mean, so as we move forward, again, we've already put together a broadband task force. Our plan had been to work with communities to pursue the broadband ready certification to demonstrate their willingness to work with broadband providers on installations. I think, again, this is an example where now we pivot and look at how can we really encourage and ramp up installation of broadband throughout the county. It's going to vary at different points in the county, but appreciate the work that at the county level it's happening around the radio tower project. I think there's a strong interest across our 11-county region to work together to advance broadband as we look at perhaps some of the funding that may become available from the state and federal government, and how do we deploy that funding specifically toward broadband deployments or broadband installation. And then again, working with partners already in the area who may be already considering broadband deployment, and how do we help them maybe accelerate or increase their activities. But certainly, I think appreciate very much the work that's gone into, for example, the schools making broadband available, companies in the area that have, I think, provided their broadband. But as we're talking about, I mean, it really, we need to have more than just those kind of Band-Aid approaches, right? It's more how do we look at broadband and internet as a utility, just like electricity or just like sewer and water, that we have to have, not just a nice have along the way.
Sure. All right. I think last week and the time before I'd mentioned the Department of Workforce Development online is hosting some virtual job fairs, if you will. Kind of looking forward to some of the bleak forecasts of some of our businesses and the unemployment. Talk a little bit about maybe some local opportunities as far as trying to keep people in work as best we can as things kind of head off into certainly a unknown direction, if you will.
Right, so DWD, Department of Workforce Development, is having regular online webinars. They're recorded if people are not able to watch them live. So certainly encourage people to work with the Work One office in the area as a resource. I mean, Work One is not just the unemployment office, it's really the employment office, both working with employers and people looking for work or better work. So we have a fantastic Work One team to call on that's tracking a number of job openings in the area. And there are companies that are hiring throughout Kosciuszko County. Again, based on our industry base with the orthopedic sector and agribusiness, we do still see our industries are running. And so moving forward is certainly, again, working with the Work One team. We can connect people to resources as well, so they don't have to navigate, when to call whichever of the different entities. But then there are also, I mean, for people who may be coming out of college, for example, or just kind of joining the job market at this time. I certainly remember coming out of college in 2002 wasn't a great hiring time for our economy. I know the Purdue Fort Wayne is having a virtual job fair. I think there are resources at Ivy Tech, at Grace College, elsewhere that can help people with internships, with job placement. And so if it's connecting to those kind of resources or that we help provide those connections, I think there's still, again, companies are hiring in the area. There's still great opportunities in the area. Matter of us making sure we connect those people with the right opportunities.
Okay. And it just reminded me of one thing. I know last week listening to the Lieutenant Governor, she talked about the Hardest Hit Fund, which I'm not, is that through Okra, or is that just I think that's an Okra fund that basically for those who have been hard hit or having trouble with mortgage payments. I believe that fund is there's an availability there through Okra for that, and just wanted to make sure folks understood that there was a resource there. I know a lot of the relaxation of penalties and delaying of tax deadlines and that type of thing are certainly designed to take the pressure off in a very difficult time. And again, we'll just have to continue to monitor that and try and keep those things moving. I know the city has done the same thing with our utility bills. There's no penalties. Again, just as our way of helping, but across the board there are a lot of again, relaxations of penalties and deadlines that again are designed to take the pressure off in these very difficult times. So, and I know the Hardest Hit Fund is another one of those. So I think, gentlemen, if you want to start with questions, we're at that point. Mr. Spalding?
Sure. I'll move up here a little closer. This is directed to both of you, don't mind. The mayor mentioned his concerns about people not wearing masks, and yet you don't want to play the role of mask police. But I'm wondering if either of you are hearing concerns from the public about restaurant workers. Many are, but I'm seeing some are not. I'm wondering if you're hearing any complaints on that.
I personally am not privy to the phone calls flowing through our central office with concerns that way. I did meet with Mr. Weaver this morning, and that was not a topic of immediate discussion. We did broadly discuss restaurants and restaurant workers and universal masking policies in general. I did not sense that we had a flood of complaints one way or the other.
I would say that the restaurants just opened back up 2 days ago. I would say that I haven't directly received any complaints regarding restaurant workers, but I do sense that there's a pretty broad concern, again, as I'd mentioned earlier, with just going into public areas and retail and spaces where employees are required to wear masks, but the public is not. And I'm getting a lot of concern that way, that we should all be doing our part, again, as we phase through this. We're just we're just in phase 2. And as I'd mentioned last week, and as the governor's mentioned repeatedly, This is a roadmap to move ahead, but it's a tentative plan, and things can change on a dime, and I know some people, it's uncomfortable, they don't want to wear masks, it seems odd to them to walk around with people not seeing who they are. Socially, it's a little awkward for people to do, but I feel like in our community, the majority of people understand how important it is, but I think people get careless. I think people say, oh, I'll just stop in, I'll be all right. And, you know, then that sets the example, and I just think it's important that when folks are into retail areas, that it's critical that they, it's highly recommended, as the governor said, that they wear a mask. But Dan, I do appreciate that question, because I sense that the public there's more people that want to go into a business and see other people wearing a mask than the other. So.
I have a question for Alan. The small business refund, is it just for profits, or can nonprofits apply for any kind of help? Because like yesterday, you know, the wagon wheel announced it was postponed its tire season, which will affect that, you know, economically. So is there any help for nonprofits?
That's a great question. So yes, the way we've set up our loan funds, I mean, nonprofits are eligible. We certainly want to work with nonprofit businesses to help them recover and sustain and grow in the community. And so if it's access to funding, great. If there are other tools we have in our toolbox, we'll certainly work with nonprofits. I mean, we're a nonprofit just like many of the others, and we look at it that we have a responsibility you know, to our team members and to our clients, and continue working.
Mr. Spalding.
So House Democrats are proposing, I think, a $3 trillion new round of funding. $1 trillion of that, I think, is dedicated to states, tentatively. So, it's kind of turning political, and apparently Jim Banks opposes funding for states. So I was wondering if all three of you could give me an idea, how critical is the need still for more state funding in our?
Well, I can start with that. With my involvement in AIM, I've been watching this. There's cities and towns, and it's not just states, it's states and local government as well, that this money is being proposed for. I think the important thing is that if the bill sticks strictly to COVID-related concerns, COVID-related loss of revenue, it might play a little better than it seems to be. It's my understanding that at least let's just put it this way, the knocks against the bill are that it's much broader. It's taking an opportunity of cities and towns that are losing revenue because of COVID-related situations, and it's broadening the application of that recovery to things that aren't COVID-related. So that's my understanding of the concerns against the bill, and I would have to tend to certainly understand that is a concern, given the amount of that bill. By the same token, there are cities and towns like small businesses and industry that have been given stimulus and recovery options. Cities and towns shouldn't be allowed to fail, given the responsibility they have to their citizens to provide the utility services, sewer and water, police and fire protection, garbage pickup. I mean, these are essentials that cities and towns are struggling with since property tax caps impacted revenue 5-6 years ago, and this just seems to be. And I'm not just saying cities and towns. You know, we're looking at local units of government, townships, fire departments, counties, even the state. I think the state reported a significant drop in their revenues yesterday. So it's not just cities and towns, it's all forms of government. But standing back even further, it's you know, it's every business, it's every non-for-profit, it's every small business, it's every industry, it's every household in this country. So taking the politics out of this thing appears to be the challenge, and trying to responsibly assist those most in need and most vulnerable would be the objective. But I know this particular bill that you're talking about is a massive bill, and I'm not sure. I see I see the concern with the size of the bill, and at least what I preliminarily understand is being proposed in that bill, beyond maybe the COVID-related expenses, if you will, and revenue loss. I hope that answers your question. And from what I hear, that will, excuse me, play out. I think this Friday, tentatively, I heard the House is going to vote on it, and you know, just if you keep up with all the chatter, that it'll face pretty stiff opposition. I know Senator Young spoke out against it last night, and I saw Congressman Banks has grave concerns with it, for, I think, legitimate reasons, but I see the importance of some type of subsidy, if you will, and support for units of government that are going to take significant hits on their revenue. So there's probably not a great answer. Again, if we try and remain objective and try and help those most in need, that's really the answer to this. So anything to add to that, Alan? I know you've been watching that a little bit.
Sure. I mean, just to build on what the mayor shared, I mean, I look at, you know, what are the gaps to be addressed, right? So if there's major gaps, you know, emerging in, you know, local units of government or state units of government's ability to deliver services, all right, there's a gap to address potentially. How they do it, again, I certainly would look to the elected officials, you know, how to do that. But, you know, as an economic developer, I mean, I think with our community, we would also look at, you know, what are the other gaps to address, like we talked about broadband internet. I mean, are there opportunities? I think there's already funding coming through some of the other recovery-related dollars to support broadband internet installation. So, you know, more of a transformative investment than just maybe you know, kind of a Band-Aid approach.
Bill, anything to add to that?
No, I think public health always appreciates more funding, so I would be out of school if I would ever turn down more funding in public health. Locally, we're fine. At the state level, they, for instance, took $18 million. I assume that came from the previous act of several weeks ago, and gave it to a contractor to help them do our previous discussion point of case contact work. Fine. That's probably the most efficient way to use that money. Instead of 18 million, could they use 100 million? I'm sure they could. You know, we'd have more case contact workers, we'd have a more robust infrastructure of disease surveillance, perhaps. It takes people to develop all of that. Whether we critically need it or not now, I'm not so convinced. We should robustly fund vaccine development, treatment development, and have fresh eyes on public health infrastructure in general across the country. So.
I do have one more for each of you.
Sure.
Quick questions. Dr. Remington, do you have any idea how many contact tracing workers will be dedicated to this county?
I don't know. I'm not sure how they're divvying that up, if it's by biopreparedness districts across the state, there are a number of those, or if it's county by county, or just as the cases come, they're spread across an office, a virtual office of 500 people. I don't know. Okay.
And Mr. Teo, you mentioned the task force, the broadband task force. Mm-hmm. Is there a county task force and then KEDCO, or is it the same thing?
So there's a county-wide group that we've helped to bring together. I think where they might see a little bit of divergence is the county working specifically on the radio tower project. That's a county project that's separate from, but still complementary to our work. And so we're looking at how do we bring together some people from around the county and basically take that baton And so what can we do with this? If we know the county is investing or planning to invest significantly in this radio project, what does that create for us as far as opportunities? And then, as the mayor brought up, then be able to really catch up as far as deploying broadband, which could be sometimes fiber on the ground, it could be sometimes wireless somewhere. It's going to vary based on where we're at in the county, but let's really look at that as a way to get a step ahead.
Okay. What does radios have to do with broadband? Is there an overlap?
Well, I think I'm not into the technology here, but so the idea is if we have these towers, those provide very tall places to put broadband. If it's wireless transmitters or cellular, I mean, it provides us a great place to start beginning to concentrate some of that infrastructure.
So the towers tend to be placed in areas that are very poor reception, and I'm pretty confident there's overlap with broadband reception as well. So it would be a common source of maybe a radio transmitter, repeater, as well as putting a Wi-Fi enhancement up there as well, yeah.
And finally, if you could just clarify, when might city parks open?
We talked about that last week, and I anticipated, actually, we've got a lot of different answers to that question. So in general, the park open space has not closed, okay? Our park offices themselves will open, again, with restrictions on June 1st. We are tentatively looking at the beaches at Pike and Center opening June 14th, but that's into the fourth stage that we don't know how that looks. We're trying to understand if there is a problem with COVID in open water, if you will. I know that we talked to Dr. Bosch at Lilly Lakes and Streams. There's not really studies about that, but is it just the social gathering of people that causes problems? Does that moist, hot environment promote? And Dr. Remington, if you want to jump in here, I know most cities and towns are wrestling with opening their public splash pads and pools, and a lot of them are being advised against it because of the sanitation concerns. The skate park, we're not looking at opening till July 4th. The playgrounds are set to open May 24th, but we're going to keep a pretty close watch on that, and that would include pickleball courts, tennis courts, and the playground areas themselves. We are kind of holding off on basketball till the next phase, phase 4. Campgrounds will open with restrictions on May 24th, primarily for just seasonal campers. Our shelters are tentatively scheduled to open on June 14th. And then our buildings, Lucerne, the plaza, and so forth, the pavilion, we're looking at, again, not till July 4th. So we've gone through with the governor's recommendations, spent some time with Larry and his staff. They've huddled and talked about how they feel the safety and their ability to respond to any concerns with sanitation, that type of thing. Again, foundation is pretty much from the governor's plans, his dates of recommendation, but I know we pushed a few things back. I know the BMX park, we've pushed back a little bit, as well as the basketball courts. So again, and we're just trying to keep an eye on that.
I have a question for Dr. Remington, and I've been discussing this with other people. Like, what would it take for, I know we're reopened, what would it take for everything to close back up? Would there have to be a bunch of tests? Say, okay, we gotta go back to phase 1, or, I mean, what would be that thing that stops the reopening, I guess?
I would think it would spring from a crush at the door of an ER, urgent care setting, clinical settings in general. And you would take as incisive as a approach to that as you could. You'd hunker down, trying to stay as close to where that you feel that pebble has dropped into the pond and started a course of ripples, and stay close to where that pebble dropped in the pond. That's a basic public health communicable disease perspective. So I don't know that you'd lay broad ground fire again. I'm not sure what it would take to do that. This horizontal interdiction, you've heard me use that term, that we've been playing with. I don't know that we'll see that come back in a big way, barring just a disastrous resurgence in the months ahead. So it'll be more surgical, more incisive. And I think you'll be watching that syndromic surveillance piece, that crush at the door feel in clinical settings.
The Fairbanks study that we've talked about, where they're testing a random population, I think they've come out, they've done their first round of testing. Have the results been?
I have not seen those published. They were trying to get 5,000 people on that first go-around, and I think they accomplished that, I believe, last weekend. So I don't know when that'll be published.
But that'll be another tool.
That'd be really interesting. We need more of that surveillance testing.
Right.
That includes antibody testing. It includes lots of people with no symptoms that you're putting a swab in their nose. And then you look at that with a different set of lenses than you do clinical case management. And we need that type of data. Yeah.
And that was another tool that was proposed at the state level to try and get maybe a broader picture of how COVID's impacting a random population, if you will.
Well,
and
back to your
just a
previous
symptomatic.
point about using a centralized case investigation contact tracing approach, I think they will find an efficient way to build into that sense of a surveillance piece of data. I'm hoping they'll be able to build that with greater efficiency than what they're able to now. So you'll know more by centralizing all that.
Right. Yeah, I know that's, and then those tests on those random individuals I think they're going to occur again in potentially May, and then maybe October, and then in a year. So I think they're going to go 1, 2, 6, and 12 months with 5,000 random individuals. So that's the Fairbanks School of Public Health, I believe, at IUPUI that's doing that, and was pushed early on.
Yeah, 3 people came together, so the State Department of Health and IUPUI, Fairbanks School of Public Health, and I believe Regan Streif is involved with that. So 3 very significant players in the state of Indiana. Yeah.
Okay. Any further questions? Nick, anything?
So talking about the positive case rate, I've noticed on the dashboard from the state, it's been steadily going down over the past few weeks, and even just by little tenths of a % over the past few days. Would you say that's more because there's more testing available and that's been going up, or does it also show that, generally we've been doing a good job on, with the social distancing and doing our due diligence on that?
I'd like to think it's all the above. I do. And you're referencing total tests going down a bit, or
No, the
positive cases?
The positive case rate, like it was 16.7% yesterday compared to last week, it was 18, the week before that was 20.
Which is what the CDC data shows too, nationally. And I think, again, we have a different paradigm of testing in general now, including more people with no symptoms that can come to a test. A fair number of those will be negative, of course. There's just more testing available in general. What we wish we could perfectly compare is the percent of positives 6 or 8 weeks ago. That denominator was just untenable, that we just couldn't quite get at it. So, but my clinical feel, also as a clinician in the trenches, is that this is just feeling softer and not as abrasive as 6 or 8 weeks ago.
Anybody else?
What inning would we be?
For those of you that didn't hear, what inning, Dr. Remington, are we in? With no fans watching, I hear.
Yeah, I think this is blowing apart the traditional 9-inning game. So I think for game number 1 of the series, we're maybe inning number 7 or 8, perhaps. I hope this is not a huge series of impressive games. Yeah.
All right, Mr. Teo, any final thoughts?
I appreciate the invitation. Again, our team at KEDCO continues to work with our community partners, with our business stakeholders. I mean, we're here to help everybody, any stage of business, just starting out, all the way to working with publicly traded companies. And everybody has different needs, but we're here to find resources and help them navigate and help them evolve their business models. And again, we're bullish about going forward. We know there's still quite a road ahead of us. If it's I don't know if it's a 4-game series or 7-game series, but we're here along the way.
All right, thank you. So we'll be back next week, same time. Again, appreciate, Alan, your time this morning, and as always, Dr. Remington, your time, and the gentleman from the Times Union, Inc. Free, and News Now 1480. Thank you for your presence, and we'll see you back next week. And just a side note, I know we're having a little bit of sound issue here. They're supposed to come tomorrow and get this fixed, so hopefully our sound won't be as reverberating as it was today. So, all right, thank you.
Thank you. Sorry to interrupt your